Hello, everyone. This is Francie Crawford from Autumn is Here. How are you today? Happy Black History Month. And also, I want to say Happy Caregivers Day. That was Friday, taping on Saturday. So it was just yesterday. I hope you had a great day. We love our caregivers. We need them so much. You're so valued. And sometimes you don't hear it enough. And when you're taking care of somebody, sometimes you don't feel the love and you don't feel that it's appreciated. But know that it's appreciated. It is necessary. And we see you. And we're just so happy that you are volunteering to be a caregiver, or you get paid to be a caregiver at a facility. That is a noble job to do. So thank you for that. Today, we're going to talk to our caregivers and to our seniors. It's Black History Month, and we want to talk about, the healthcare system a little bit and some of what we can do to help ourselves to be more equipped to have quality care. There is about 55% of Black Americans have healthcare coverage, and to 73% of white Americans who have healthcare coverage, and most of that is private coverage. A lot of Black communities have public coverage, and that also means that you don't get the best coverage. So we're want to make you aware of that, and we want to also make you aware of some of the things that you may need to know if you get sick, or if you go in the hospital, or if your loved one goes to the hospital and you're their caregiver. You have rights as a patient, and you have rights as a caregiver who is responsible for the person that you've taken care of and that you're taking to the hospital. And hopefully you will have the papers together. You will have your healthcare proxy together. You will have your POA, your power of attorney together, and things like that prior to going. You never know when someone's going to get sick and they're going to need medical attention. And we do know in general that the hospitals, doctors, healthcare professionals are going to try to take the best care that they can. Some facilities are not set up for the actual best care. Some facilities in communities that are underserved may not have the best care and equipment in their hospitals. They may not have the top doctors. You may not have the creme of the creme of doctors. You may not get all the right information, Sometimes you will get some in bits and pieces. So we want to make sure that you know that you have rights. So often we see that information is presented to us when we're in a hospital, and sometimes in the middle of a crisis, you can't hear it, or you hear it and you remember it at the moment, but you don't really remember everything, or you don't understand it. And we tend not to ask questions. And I mean, we, not only Black people, I'm talking about just people in a crisis situation, or your loved one is sick. You don't ask questions. You hear the doctor, you trust the doctor, you hear them saying big words or things that you've never heard of before, and you kind of keep it going and trust that they're doing the best that they can. But you have certain rights. 40 to 80% of what the hospital or healthcare person is telling you is forgotten almost immediately. And these are crucial information that you need so you can make a better determination and judgment for the well-being of the person that you're caring for. So we want to let you know that, you have rights. Every day, something else in different situations are happening. Just this week, a friend of mine, parent, was in a rehab place to learn how to walk for about a month ago. And during that time, they got ill. Medically ill. Now, when you're in a rehab facility and you get medically ill and you're staying there, they have to send you to the hospital. So now you have to go to the hospital, and she had to go to the hospital, and she got taken care of. And but it took a couple of weeks because it was medical issues, and she's okay. So now she's ready to be released. And they said, oh, okay, she's medically okay. We're going to release her. And the daughter thought, okay, well, you're going to release her to the rehab. And they said yes, but then the rehab, the insurance refused to continue the care at the rehab. So they told the daughter, well, they're just going to send her home. Well, if you're not able, willing, and available to care for a loved one from the hospital cannot release them to you. You have to be ready, set up, willing. Now your heart is willing. Sometimes you want to do it and you say, oh, you try to figure it out. But when someone is immobile, it's hard if your house is not set up for that. It's hard if you're working 12, 14 hours a day and you have to set up somebody being home and a nurse's attendant. You're not ready to receive that person. And here the hospital is saying, they're ready to release them. So if you're not able to do it, you have to speak up. You can't just try to fit it in and work it out. There are things that you can do. One of the things is you have to call the insurance company and challenge them and ask them why they did not honor their rehab request and or continue it. And you put in an appeal. When you put in an appeal, it stops all action. It stops the hospital from releasing the parent until that appeal is satisfied. It could be 48 hours, 72 hours, whatever, but it gives you some time. Also, you have to speak to the doctors and get a medical care report. What's going on with your parent? How much activity do they have? Get a physical therapist evaluation and find out, how much more physical therapy that the parents are going to need. Can they walk? Can they not walk? Are they send them home with a wheelchair? Whatever the care instructions are, they need to have that in place. And all of that was not in place, but here they are ready to release her. So these are things that you have to fight back for. You have to know that you have certain rights. I know it's like overwhelming at the moment, but you have to know that you have certain rights. Then after you speak to the doctors, get evaluation, physical therapy if that's needed. Social worker can help you to sort through that, find places, you don't have to go out and say, well, let me pay for a place or whatever. They have places where the insurance can say, okay, we can pay for a temporary respite where your parent can go for a couple of weeks until you straighten out all the business or straighten out the circumstances or things like that. So please do not panic and know that you have rights. And when you are in a hospital, now everybody, if they had the experience of being in a hospital or taking a loved one to the hospital, they have the patient's rights and regulations that they give to you, and people sign for that. Now, I know when they give it to you, what do you do with that? I know what you do. You go get a cup of coffee, you find a nice quiet place to sit, and you read through all the patient's rights and regulations, right? That's what you do, and their responsibilities. No, that's not what you do, because we don't. Okay, we sign the paper, which when you sign the paper, it lets them know that they've given you all the information that you need to tell you what you can do. But after you sign the paper, you're supposed to read it before you sign the paper, but you got to read it because you got to know what your rights are. You got to know what your rights are. And especially in communities where they're underserved or they're not getting the best care or they're not getting the most experienced doctors. Sometimes you gotta, you gotta give the doctor some knowledge that you know what you're talking about, or you know what your rights are. You may not understand the medical terms, but you know what your rights are. And if you don't understand that there are certain things that they have to explain it to you, but you have to say something. You have to, first of all, you have to be treated with respect. They have to listen to you. You approach them with respect. They have to treat you with respect. You also have to be able to understand what they're talking about. And if you do not understand, whether it's that you don't understand it as far as the terminology, please ask them again. Also, it also means that you can have a translator. You may speak another language. You may not be able to understand English clearly. So they have to get somebody who can interpret or translate the care, the treatment, what the plans are, all of that. They have to be able to do that. So ask for that. You can ask for that. You are supposed to make sure you get quality care that is standard general care that everyone expects from every hospital, no matter what hospital it is. It could be the top hospital. It could be a clinic. You have to get the best care. They have to respect your spiritual beliefs. If you have certain beliefs that you don't want certain medications or certain treatments, they have to give you that and dignity in treating you, and they have to value that. Now, you also have to know that you can refuse treatment or procedures, but they have to explain it to you. And if you do, that is your choice. They may, in that instant, they may offer some other care, or maybe they can't do what they need to do because you've refused it for whatever reason, for beliefs, for fears, for not understanding. Understand that they have a responsibility also. So once they explain it to you, you are allowed to refuse treatment or care. But know that there are there's risk factors with that. Or ask for another way to do that. Ask for all the options. One of the things that when a doctor explains to you, they may explain the technical and medical stuff, but sometimes they don't explain all the risk factors that can happen, all the things that can happen. That's something you have to ask. If they don't explain the risk or the complications that can happen, or what's going to happen afterwards, how is this person going to be afterwards? How are you going to be afterwards? What is needed afterwards? Ask them until you are clear on that. You have the right to know information about the person who's providing help to your or care to your loved one or to you. You have the right to know about the doctor. You have the right to know about his credentials. You have the right to know about any healthcare person. If you have a question about them, you have a right to know. Ask. It's okay. Make sure that you're doing everything that you can do, and make sure they explain all of the care and diagnosis, okay, and the procedure and the prognosis. Make sure they explain all that. You have a right to ask for attending physician if you want to. You have residents and you have attendings. And residents are graduates, but they are doing their post-op in the hospital, and they are under the attending. So if you feel more comfortable with an attending, then please do ask for them. Attending is a board certified physician. You have a right to your medical records. If you want your medical records, you have a right to get them, get a copy of them for whatever reason. Maybe you want to see what's on it, or you want to take it to another doctor, then make sure you know that that is your right. So just ask for that. You have a right to informed consent, for the doctor to tell you what they're going to do, planning to do, what's going to happen next, surgery, treatment, whatever. But you have to be informed and understand it so you can make a better decision on whether you want to do it or not. And also that includes if they're thinking about doing something that involves research, clinical trials, alternative medicines. You may or may not want that, but let them explain that to you, and you can consent to it, or you can refuse it. You have a right to understand all the charges for the medical care. Hospitals are very expensive, and even if you have insurance, sometimes you have to pay a percentage. You absolutely have a right to understand what the charges are for the care. So don't forget about that part of it. If you have any grievances, you have a right to complain. You have a right to complain to the staff. You can call your patient advocate and speak to them and voice your opinion and in your complaint properly, and they will be able to address it and help you through a situation. So please know that you have these rights. You have a responsibility to ask questions and the treatment plan and things like that, and accept the outcome. But you have to ask them, what do you expect the outcome to be? Okay. I say this because, we trust doctors and we trust hospitals, and we trust our city and our state that everything is in place and things like that. And they have things that they put in place for us so we can have the information that we know we can ask for. You can do but so much, but you have to know your rights also. Every medical facility is different. Every person is trained differently. Every place gives different kind of care. We want to believe that every place is going to give equal care. There are times I've heard stories and I've had experiences where it's not the best medical care for whatever reason. Sometimes it's because of where they're located in the community that's underserved. So I want to make sure that people know that the intent is to care, but things fall through the cracks. People have their own interpretations. When years ago, and things that happened years ago sometimes still happen now. And years ago, not sure if I told the story, my brother came home and he was hurt. His arm was hurt. And I was like, oh, what's going on? And he's like, he fell in some construction. So I said, oh, so he was hurt. So later on, it hurt more. So he called the neighbor to take him to the hospital. The neighbor took him to the hospital. They bandaged him up. And, he had a sling and everything. A few weeks later, he was saying something. I didn't understand him. I understand a little bit, but I didn't understand him. I said, what's going on with you? I said, you might need to go to the doctor. So he went back to the hospital. They admitted him. He was having a stroke. So he was at the hospital and for a few weeks and came home and he was better. So I was like, okay. And then a few weeks later, I couldn't understand him again. It's like, what's going on? And he went back to the hospital. He had another stroke. So he was in the hospital. He had a stroke. We're going back and forth. Okay, he walked into the hospital. He took himself to the hospital. When I get there, it's hard for him to walk. He's having a hard time walking. Okay, fine. I visit him a few times. He's been in hospital. He was in hospital for over a month. And I visit him frequently. And as I'm visiting him, first he's walking with a cane now. Now he's walking with a cane. Then they had a wheelchair. Then he couldn't get out of bed. So I kept saying, well, he's getting worse. What are you doing? What are you doing? He's getting worse. And they kept saying, no, he's getting better. I'm like, how is he getting better when he walked in here and now he can't walk? So fast forward, I came there one night and he was so heavy. I had to change him and stuff like that. He was so heavy. He was wasting away being skinny, but he was so heavy. And I was like, what is happening? He's deteriorating. What is going on? What are you doing? Whatever. Well, he said, he's having a stroke, so we don't know why he's having a stroke, so we can't give him medication. And I was like, what do you mean you can't give him medication? He's been here this long. How could you not be giving him medication? Well, we're trying to find out why he's having a stroke. We have another test that they're going to give him that week. And they said, and then she whispers to me, well, he was a drug addict. Yeah, many, many years ago. Okay, but he's not now. She says, well, he doesn't have an insurance. It was this old nurse, this nurse that, experienced nurse, And she says, well, he doesn't have insurance. And I was like, well, why doesn't he have insurance? He works. She said, he works? Yeah, he works. As he works for the government. I'm sure the government has insurance. And he's been working there for years. So she's like, oh, I didn't know. It's not down here. What? I said, well, because when he came in, he couldn't talk. Oh, talk clearly. So I don't know what he wrote down, but he couldn't talk clearly. So they didn't know he had insurance. So they thought, and now this was in the early 90s, I didn't realize they assumed that he had HIV and AIDS, but they never took the test. So he has been here for almost a month now, and you've never taken a test. He's deteriorated every week. He was less and less. And I was like, why wouldn't you take the test? What does the test say? And they said, well, we didn't take the test. Well, why? If this is what you believe, why didn't you take the test? So now I have to go to administration and fight with the administration to take the test. And the administration was like, oh no, of course he has to take the test. Why do I have to do that? But took the test. They took the test 3 times. Now, he was clean for about 10 years. So that means that if he had it, he would have had it over 10 years. Never showed up. Didn't have it. 3 times they took the test. Didn't have it. They assumed because of his past and his background that if he wasn't a drug addict, he still probably did some drugs or something like that. I didn't know. I was in my late 20s, I guess, 27, maybe something like that. I didn't know about hospitals. I didn't know that this was a ward, that this is where they had put people who didn't have insurance, where they just did the basic care for them. I didn't know anything about wards. It wasn't a room. It was just like barracks. And I didn't know that they were just there and they weren't servicing them because they didn't think they had insurance. Now he doesn't have HIV or AIDS. He's having strokes. Now they're trying to do something, but he's already withered away. And he couldn't really speak clearly. And the last thing he said to me, and this is, I think he must have mustered up all his strength because this was clear. He said, "Don't let me die here." Now, people go when God says to go, but you don't have to go like that. You could have had better care. You could have, they could have called. You have also a right that if you are in a hospital and you can't comprehend or are in a position where you understand what's happening to you, you have to have someone that is there or someone that they can call and explain what is going on with you. There has to be someone, a representative that is working on your behalf. They have to call them. Someone has to know that you're there. They have to try. Now, we were here. They didn't call us. I didn't exactly know what was going on with my brother. They didn't reach out to us. So that's why I'm telling you, you need to be the advocate for your family member, for the person you're caring for. You need to know your rights. These are some of your rights. Read that Bill of Health. The Bill of Rights that you have, and for the hospital and the patient's rights and the responsibilities. Read it, act on it. I know in a time of crisis you don't have it, but you can get a copy, and you can read through it so you know ahead of time if something should happen. What you have. These things happen then. I'm sure they happen now, and especially in neighborhoods that are underserved. Look out for our people. Make sure that anything that you can do, put things in place, knowledge, wisdom, share it. It's unfortunate. We are grateful to have a country that we have good health care and the opportunity to have good health care. But sometimes we just have to make sure, because especially now, hospitals are understaffed. Doctors and nurses are overworked. They're human like we are. They make mistakes. They have issues also in their private life. They have parents that they're taking care of. They have illnesses that they're going through. So they can make a mistake. Sometimes you have to be the one that bring them back to, okay, listen, I know that you might be able to do something else. I know that there might be another way to handle this. You understand what I'm saying? You might have to be the one to make them remember that, okay, I got to stay here, stay focused on this case, because they might be running to the next case. Do it with respect. Make sure they respect you and you respect them, and make sure the patient advocate, if you have any questions, go to the patient advocate. If you have any complaints, go to administration, go to patient advocate, and get the help that you need. We have to help ourselves. That's my story. That's my show today. And I just hope that you get something from this, and don't be afraid to speak up. Don't be afraid to arm yourself with tools ahead of time. So when it's time to use them, you have them. All right. Thank you for tuning into Autumn is Here. I'm Francine Crawford. I hope you like my show, and please hit subscribe, and please leave a comment. We really want to know what you think, or that you got something good out of this. All right. Thank you again. Bye-bye.